السلام عليكم ورحمة الله وبركاته. My name is Rayan from College of Applied Medical Science. And today we're going to talk about chronic obstructive pulmonary disease. Then we have the objectives, which is what is the chronic obstructive pulmonary disease and the causes and symptoms of COPD and how we get affected in our daily life by COPD and the risk factor and complications and how to reducing the burden of COPD. Here we have the key facts of COPD is the third leading cause of death worldwide, caused over 3 million deaths in 2019. And the environmental export to tobacco smoke, indoor air pollution, and occupational dust and fuel chemicals are important risk factors for COPD. And over 80% of these deaths occur in low and middle income countries. Early diagnosis and treatment include smoking cessation support is needed to slow the progression of symptoms and reduce flare-up. The chronic obstructive pulmonary disease is a chronic inflammatory lung disease that causes obstructive airflow from the lungs, is typically caused by long-term exposure irritating gases or particular weight matter. Most of the time from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and a variety of other conditions. Causes and symptoms of COPD result from long-term exposure to harmful gases and particles combined with individual factors. Symptoms often appear until significant lung damage has occurred, and they usually become worse over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include shortness of breath, wheezing, chest tightness, chronic cough, reduced mucus, and frequent respiratory infection, lack of energy, weight loss, swelling, and ankle. The causes of COPD develop gradually over time, often resulting from a combination of risk factors like tobacco export from active smoking or massive export to secondhand smoke, occasional export to dust and fumes or chemical, indoor or air pollution, biomass fuel, like wood from animals burned to crop and residue. How your lungs are affected. The COPD causes bronchial tubes and air sacs to lose their elasticity and overexpand, or leave some air trapped in your lungs when you exhale. Causes of airway obstruction include emphysema. This lung disease causes destruction of the bronchial walls and mystic fibers of the alveoli. The chronic bronchitis is a condition your bronchial tube become inflamed and narrowed and your lungs produce more mucus which can further block the narrowed tubes. We have two pictures of emphysema and chronic bronchitis. The impact of COPD on daily life. Common symptoms of COPD develop from midlife onward include breathlessness or difficulty breathing, chronic cough, often with phlegm, and tiredness. As a COPD progresses, people find it more difficult to carry out their normal daily activities, often due to the breathlessness. They may be considerable financial burden due to limitation of workplace and home through activity, creativity, creativity, and cost of medical treatment. During flare-ups, people with COPD find their symptoms become much worse. They may need to see extra treatment at home or be admitted to hospital for emergency care. safer flare-ups can be life-threatening. The risk factor of COPD exposure to tobacco smoke and people with asthma may have risk factor for developing COPD or conditional exposure just to chemicals and fuels and exposure to fumes and from burning fuel. Genetics, that uncommon genetics disorder, alpha-1 antitrypsin deficiency is cause of some cases of COPD. Complication like respiratory infection, a heart problem, lung cancer, high blood pressure in lung arteries, and depression. The reducing model of COPD, there is no cure for COPD, but early diagnosis and treatment are important to slow the progression of symptoms and reduce the risk factor of flare-ups. COPD should be suspected if a person has clinical symptoms and diagnosis confirmed by a breathing test called spirometry, which is measure how the lungs are working. In low and middle income countries, spirometry is often not available, and so the diagnosis may be missed. There are several actions that people with COPD PD can take to improve their overall health and help control the COPD, stop smoking, take a regular exercise, uh, get vaccinated against pneumonia, influenza, and coronavirus. Talk to your doctor if you feel sad or helpless or think that you may experience depression because you cannot perform your daily life as normal. And here we have the last thing, our resources. And thank you so much for listening. Do you have any questions? Thank you so much.